Hi, everyone. My name is Maximilian, and I'm one of the co-founders and chief strategy officer at Ilara Health. It's a great pleasure to be here to be presenting virtually from Nairobi. So at Ilara Health, we're building a network of primary care clinics delivering affordable, quality healthcare to Africa's low to middle income demographics. We do this by financing the deployment of essential equipment within existing, under-equipped outpatient clinics across the continent, and then digitize these clinics through our software tools. Existing healthcare systems will be enabled to keep Africa's rapidly growing population healthy. There's an access gap with an estimated 500 million people struggling to access essential diagnostic services. There's a knowledge gap where over 55% of the time, clinical guidelines are not adhered to by care providers. There's an infrastructure gap with over $66 billion missing in yearly health financing. And then there's a payer gap with less than 1.5 insurance penetration prevalent across the continent. So how are we addressing this? We're addressing this by empowering the over 200,000 independent primary healthcare centers operating across the continent's hyper-fragmented care ecosystem. These are clinics that provide care to hundreds of millions of patients each month and generate over $10 billion in yearly revenue. And we began our journey by focusing on the diagnostic gap, financing essential diagnostic tools to PHCs across Kenya who previously could not afford such devices, nor could they access alternative forms of financing. This became our wedge, allowing us to build relationships with hundreds of clinics and generating growing revenue streams. Over time, our model has evolved to address adjacent pain points faced by our clinic partners. Access to quality medication, therapeutic equipment, utilities. In essence, we began to finance everything a clinic needs to deliver better healthcare. And we couple this with our clinic operating system to digitize the clinic's operations from end to end. What we're doing here really is building essential services and technologies needed by clinicians into a clinic in a box, a bundle, if you will. And our long-term vision here is to build a sustainable model of great care delivery across Africa. We believe that we can deploy our clinic in a box to thousands of healthcare centers across the continent, empowering them to deliver the best possible care to their immediate communities. And we've been very fortunate to have received support from incredible partners to achieve our mission. And a big shout out, needless to say, to Google for Startups for having us today. And we have an incredible team backing us with clinical, tech, operational expertise to help us achieve our mission. Thank you, and please do get in touch if you're excited by our mission.
One question, so maybe I missed it. What are you actually raising?
So we're currently, we're preparing for Series B early next year. So in the midst of building out our relationship with investors as we speak.